For the whole month of December, we're going to talk about something more lighthearted, essentially all the weird and wonderful operations or intervention that we can do to the male penis in order to make it shape or actually function better. And one way that most people actually ask about is how to elongate or actually enlarge the penis. And today we're going to talk about that and whether to see that's possible. In fact, penile enlargement is a controversy operation because in reality, it doesn't really work that well. However, many men, although have a very normal penis, actually seek in order to make it look longer. So the big question is, how long is long? Obviously, we want to see the actual flaccid state and actually the erect state. In a flaccid state with a stretch flaccid state, it should be ranging between 11 to 12 centimeter. However, in an erect state, it should be between 13 to 15 centimeter, which is the range. However, people who really have micropenises are the ones who have less than the 5th percentile in the smaller range, which is about 7 centimeter. So when it is truly problematic, how do we enlarge it? So in the old days, historically, there's always been these non-surgical intervention that include traction, basically a pulling that actually is called tribal elongation. With this, you can imagine that in many tribal culture, it has been practiced, but it doesn't work that well. Whenever the traction is a bit pulled too much, it might cause some injury or hematoma to the penis itself. So two operations that commonly is applied will be, number one is severations or the incisions of the suspensory ligaments. When the incision of suspensory ligament with a bit of reconstruction, the penis itself can be elongated by 1 to 2 centimeter. The other type of operation that is done actually is lipoma removal, or called lipomectomy. Basically, this is essentially for a buried penis. You remove the lipoma around the buried penis in the pubic area, and somehow it actually makes the penis look slightly elongated. This operation, you can imagine that in the removal of these fatty tissues might cause some infection and scarring, a little bit similar to the actual suspensory ligament incisions, and might even cause some scarring and infection that might be too unsightly later on post-operatively. For the following week, we're going to discuss about when the actual penis itself, in order to increase the girth, some people started injecting all sorts of things. What is being injected? What are the complications? Then you need to stay tuned for next week's Putting Dr. G on the Spot.